Clinical decision making. Introduction. The problem of diagnostic error. Clinical reasoning. Definitions. History and physical examinations. Use and interpretation of diagnostic tests. Normal values. Factors other than disease that influence the results. Operating characteristics. Sensitivity and specificity. Prevalence of disease. Dealing with uncertainty. Problem representation. Cognitive biases. Type 1 and type 2 thinking. Common cognitive biases in medicine. Thinking about thinking. Human factors. Shared decision making. Patient centered evidence based medicine. Effective team communication. Using clinical prediction rules and other decision aids. Reducing errors in clinical decision making. Deliberate practice. Cognitive debiasing strategies. Clinical decision making. Putting it all together. Answers to the problems.